Oh, stop. So it's not a normal knee
So-
now, and
Let me show you her other leg real quick.
okay.
So on this leg, when we do a patella, we both deepen the groove, but we also slice the front of this right here off and shift it over to the side.
Okay.
But if you look at the knee that they've done here, they've totally redid this and realigned it in order to fix the ACL rupture.
Okay.
So now this looks nothing like the other leg, and I don't know
No.
if I'm going to do more damage trying to shift this because that's been made that way on purpose to fix the ACL.
Oh.
So what I may be left with is just deepening the heck out of the groove and then grabbing the outside of this and bringing it behind this little bone and tying it. I don't know that I can do a normal tibial tuberosity. I may be able to, but I don't want to mess up the, ACL surgery. And that's why they did all this. I mean, you can see this big hunk of bone. That's what they shift. This is what it looks like before the surgery. You don't have that huge hunk of bone. So they've cut this here and shifted this all up to fix the ACL.
Okay.
So that's why.
Is that normal to do that?
It
fix
is.
ACL. Okay.
It is, and that's how they do the TPLO, but that also now is not going to allow me to do a normal tibial tuberosity transposition. So all I may be able to do is deepen the groove, grab the corner of the patellar tendon and loop it back behind this little bone and hope that that's enough to keep it in the middle without having to move the actual patellar tendon.
Now,
What I can do is I can also call Sam Franklin. He's an orthopedic surgeon at Kansas City Orthopedics, and I can ask him about that and say, hey, look, if I were to take the front of this piece off and shift it, am I going to totally screw up the ACL? Or is it even possible to do that once he's had that? Because then if not, like I said, I might just only be able to deepen the groove and then hope that if I lasso it back behind this bone, it'll stay with a nice deep groove in that. So yeah, I can give him a call and ask him. He's terrific about talking to us, and he's wonderful about it. Really, really nice guy.
And if all else fails after this, is it one of those things where amputation?
Yeah, I mean, I don't know. I mean, she uses the leg. She's painful, but she is still able to use the leg.
She jumps up in the
I don't know that you'd want to amputate because her other knee is bad. And if you take away, she already has a very arthritic other knee. So that's going to only give her one to get up on. So I don't think she'd be an amputee. I think should be a matter of pain medicine and keeping her as happy as she can be. The other thing I think you should start on her regardless is high dose fish oil, like getting her up to 3,000 milligrams of EPA and DHA a day. That can have remarkable effects on arthritis.
Well, and I started her on, of course, the hip and joint, glucosamine, chondroitin sulfate, and all that.
I see it's an off-label use for fish oil, but 1 to 3 months loading time. I've had some of these chronic ACL dogs totally change and do better once they get that on. Now, the biggest thing with fish oil, you want to stop it like 2 weeks before surgery because it makes your blood thinner. So, but that is something to think about. So I think what I need to do is probably give Dr.
She's been on fish
a
oil, but it's only been like 500 milligrams. So definitely need to really boot her up.
What you'll want to, certain types of fish oil have higher levels of EPA and DHA. Those are the omega-3s.
Okay.
For instance, a general one over-the-counter Nature Made, even the 1,200 milligram fish oil only has 600 milligrams of those two things per capsule.
Oh,
you want to do 3,000 of the EPA and DHA, not of the fish oil. So 1,200 milligram fish oil only had the 600 milligrams of the fatty acids. You'd have to give her 5 a day.
Oh,
but you can find other types of fish oil, like the Nature's Bounty at Costco that I take myself has per capsule 980 milligrams. Which case, then you could just do 3 of them and be close enough on 3 of them instead of 5 of them a day. And I did have one client bring in some type that she took that had 1,200 milligrams per capsule. So you can find other fish oils, but it's the EPA and the DHA that you want to add up to 3,000 milligrams.
Because we give Nakota that,
You want to do a
And,
much higher dose for arthritis.
and I'm not for sure what brand we give him, so I have to
Most
look.
over the counter just has 600 milligrams per capsule of the fatty acids.
And I think it
that's-
is like a Nature's.
Nature's Made is the most common one you see over the counter. I used to take it too. 1,200 milligram Nature Made.
Okay,
You can
that's-
find it at Hy-Vee and all the pharmacies and Walmart and Target.
Yeah.
So yeah, the higher of the
Okay.
EPA and DHA, but I can give Dr. Franklin a call and see what he says about that. That if stretching that or moving it, if it's going to totally screw up the whole ACL, and I'm just going to be
Okay.
stuck with doing the groove. But you can see here, it's laying on the side, even in this picture.
So it's not been doing her any good trying to stretch it then. It's
Yeah.
just popping the knee
It's just
in and
popping
out.
in and out like crazy.
Okay.
Yeah.
Well,
And
no
I mean,
wonder
there's
she
not
was.
much they're going to do about the ACLs at this point. There's always going to be
Okay.
chronic arthritis once you've had an ACL rupture, and that's why
Okay.
the fish oil. That I've had some pretty remarkable changes on fish oil in dogs.
Okay.
So
Well, we got a Costco card, so
There you go.
we need to go do some
Yeah,
shopping
I can-
anyway.
yeah, so I know like
Yeah,
I'll write
if
down
you
the
can write
Nature's
that.
Bounty just so you have that. It's an all green, but yeah, that's